When it comes to staying well, prevention is powerful. Regular health screenings can catch problems early, sometimes even before symptoms appear, and that can make a huge difference to treatment and the outcomes. But let's be honest, life is busy, and between work, family, and everything else, it's easy to put our own health on the back burner. Sometimes we're unsure what checks we need or when to get them. Sometimes we're just too tired to prioritise ourselves. But knowing which screenings matter and taking the time to book them can be one of the most important steps we take for our long-term well-being. So let's break down the key checks that women should know about and how to stay on top of them. Cervical screening is one of the best tools we have to prevent cervical cancer. If you're aged between 25 and 64, you'll be invited for a smear test every 3 to 5 years, depending on your age and previous results. This test doesn't look for cancer directly. It checks for a high-risk HPV, the virus that can cause changes in the cervix. And spotting those changes early means that they can be treated before they turn into something more serious. Smear tests are estimated to save around 4,500 lives a year in England, but still around 1 in 3 women don't attend when invited. Whether that's embarrassment, fear, or just a packed schedule, you're not alone, but it's worth remembering the test is quick and the nurses doing them are brilliant at putting you at ease. So if you've missed yours, it's never too late to book in. Breast cancer is the most common cancer among women in the UK. 1 in 7 will be diagnosed in their lifetime, and the earlier it's found, the better the outcome. The NHS invites women aged 50 to 71 for a mammogram every 3 years, with some areas actually starting from 47 now. After 71, you can still ask to be screened. In the years 2023 to 24, 70% of women in this age group went for screening. That's the best uptake we've had in 5 years. Screening is thought to save around 1,300 lives a year and detect about 19,000 cancers. Now, in the meantime, stay breast aware, get to know what's normal for you and check monthly. Look for lumps, changes in shape or size, dimpling, nipple discharge, or anything that just doesn't feel right. And don't forget under your arms and up to your collarbone. If in doubt, speak to your GP. After menopause, our estrogen levels drop, and that can mean a drop in bone strength too. Osteoporosis affects over 3 million people in the UK, and women are especially at risk. A DEXA scan, a type of bone density scan, can help identify whether you're at higher risk. It usually is offered to women who have certain risk factors like early menopause, long-term steroid use, smoking, or a family history of osteoporosis. Even if you don't need a scan yet, there are things you can do to support your bones now. So get plenty of calcium and vitamin D. Stay active, especially with weight-bearing exercises like walking or dancing, and limit alcohol and smoking. Heart disease is often seen as a men's issue, but it's actually the #1 killer of women worldwide. And in the UK, coronary heart disease kills more than twice as many women as breast cancer. That's why from the age of 40, women are offered a free NHS health check every 5 years. And it looks at your blood pressure, cholesterol, weight, diabetes risk, all of which are important markers of heart health. And here's something that many people don't know. Heart attack symptoms for women can look different. So instead of the dramatic chest pain, you might feel fatigue, nausea, jaw pain, or breathlessness. Now, if something doesn't feel right, just trust your instincts and get it checked out. Know your numbers and use them to stay informed about your health. Mental health might not come with a formal screening test, but it is just as important. Women often face unique mental health pressures, from postnatal depression to the hormonal shifts of perimenopause, and are more likely than men to experience anxiety and depression. About 1 in 4 adults in England will have a mental health issue each year. And for young women aged 16 to 24, that number rises to more than 1 in 4. Yet stigma, lack of time, or a desire just to keep going can stop us from seeking help. If you're feeling low, anxious, or just not yourself, please don't push it aside. Talk to your GP. Try and build small habits into your day that support your mental well-being, like getting outside, sleeping well, staying connected to people you trust, and setting boundaries when you need to.